This is a DBT podcast. Welcome to the DBT podcast. Don't be triggered. This is where we talk about facts and we interview experts that have been doing this for 30,000 hours or more. Real information from real doctors, real professionals. We talk about facts, and I want to define a fact for you. It's a statement that can be objectively verified as true based on evidence, observation, or documentation. Science. What's science? I think many times we've forgotten that. Study of the natural world through evidence-based reasoning. For example, a fact is that the Detroit Lions had more wins than the Chicago Bears the last 2 years. Fiction. Ben Johnson can beat up Dan Campbell. A fact. The Detroit Pistons had more wins than the Chicago Bulls the last year. Fiction. Any player on the Bulls is objectively better than Cade Cunningham. Fact. Detroit Tigers lead the American League in wins. Fiction. The Chicago White Sox have any chance of winning the division. Today, we are going to talk to the gatekeeper of medicine. All of us go to a general doctor, including me, to talk to them about our health. Even when we're feeling good, we go for our yearly checkups. I wanted to bring in someone that, really understands how to talk to patients, when I say patients, I mean me and every human being, in terms of the amount of experience. We're going to talk to a general doctor, a family practice doctor today. His name is Dr. Anand Shah. He's been a close friend of mine for many years.
What's going on, brother? How
Thank
you
you thank you for driving all the way here and joining us today.
Man, it's all good.
Yeah. So I got to ask a basic question to everyone out there first. Like, why see a doctor? Like, why would you go see a doctor? Let's say you're feeling great. Let's say you just went to Vegas and you spent the weekend there. You had a great time. You have no ache or pain in your body. You're sleeping 8 hours a day. Like, why would someone need a general doctor? And what age do you think they should see a general doctor? Let's say they haven't seen a doctor, up until they're 21 or something like that.
That's a great question, man. And I think that's, leading to that question is like kind of one of the issues with healthcare today, I think, is because I think too many people wait until they're not feeling good. And then they finally decide, I'm going to start seeing the doctor. And I'm going to be doing this throughout, but just because I have a good understanding of I'm into cars, that. And so it's like, you kind of think like a car, and like you buy one off the lot, you lease it, brand new, it's going to run perfect, right? But that doesn't mean you're not going to go take in for oil changes and checks, right? You're not just going to take it and just drive around the road, put your family in it, and be like, yeah, everything's okay, it's running fine today. And I kind of tell my patients, that's kind of how our bodies are, right? We're just, it, man. We're just highly... I
think that's a great analogy.
Yeah.
Actually, I've never actually even thought of it that way. I don't think we've ever had that conversation.
Yeah, man. It's just that's kind of how I like to explain to my patients. It's like we're just highly evolved and engineered machines, And even though the damage is being done day to day, we may not feel it until things have progressed, And so it's more about health maintenance, and being a GP, what I like to do with my patients is let's keep you feeling good. And that's why you want to start coming early. And I don't think it should ever stop. We get through, we're kids, we're seeing our pediatrician, and all of a sudden we get older, we're done with our shots. Our parents are like, yeah, they're fine. Maybe we go off to college, and people just forget. And then classically, I get the patients once they're in their 40s and their 50s, and things are starting to feel something, and I'm just like, coming before that, and there's so many diseases that are preventable.
So I think it brings up the big point that, none of us are going to live forever.
Yeah.
But thankfully in 1975, we didn't have many medications to treat, and I'll just speak for cancer medicines. Even 20 years ago, there was 30 cancer medicines. Now there's over 300.
Yeah.
So I think things have changed for the better. We understand the human body. You mentioned the machine. We understand that machine better now than
100%.
we ever have. My mom has sisters. She knows she had sisters for a few years, and then they passed away from some disease when they were kids. We don't have that childhood mortality as much anymore.
Right. Yeah.
So it's why not go knowing, understanding, and living in reality to where, as you said correctly, we're not going to live forever. So why not get checked out and try to catch stuff early before you have whatever it is, heart attack, stroke, or anything else. So is that kind of the gist
I
of
think
it?
so. Yeah. I mean, like and then, just kind of like lifestyles, especially in this country, we're just like kind of go, 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 all about our careers or our kids and their stuff. We just kind of put our health to the side, not really paying attention to what we're eating or how much exercise we're getting, right? And our sleep and everything. And then all of a sudden it's like decades have passed and now we're kind of backtracking on it, Whereas it's like if I get someone coming in when they're feeling good, I could be like, hey, look, your sugars are a little up or your weight's a little up, let's try to correct these things now so that later you're not suffering from, terrible arthritis in your joints because your weight got so high or now the diabetes it's doing its thing, And so it's all about like maintaining that health before it gets to that point,
Do you think the reason behind that is that people just psychologically believe that if they feel good, that nothing's going to happen to them forever?
Yeah.
Is there some sort of, I mean, I have that same thing. It's not just people, it's me
Yeah.
too. Like sometimes I'm like, man, I'm invincible,
Yeah, 100%, man. There's, I think, that whole like mentality of like, if it isn't broke, don't fix it type of thing, And I think a lot of people
But it is going to break.
Yeah, 100%. And I tell people, like, we're all going to die. You just got to decide, like, at what point do you want to start feeling bad? Do you want to go on and do that for 3 decades? Or is it like you go until 85 feeling great and then,
something's going to happen.
We all succumb to something,
Yeah.
And I think that's the big argument. And I think that's personally how I see it. Like, man, I don't want to, you see it all the time with our older patients, man, and how they're feeling. And it's like, gosh,
Yeah,
could have done things differently.
Do you think, like, over the last 50 years, things have just dramatically improved in our understanding of how to either prevent disease or catch disease early?
Yeah, and I mean, like you said it, right, with the oncology drugs, right? Just like the advances in technology in terms of diagnosis and testing and treatment, and then just like the overall, like, ability to share this information, and like convey, like, hey, this is going on and this is good for you and this isn't. And like, how many patients do we get? I mean, for the better and worse of it, probably more so for the worse, but like social media, they hear something, they bring it to us and they're like, I'm hearing this about this, and then we can course correct if we need to. But I think
so that's not to cut you off, but that's the point of this podcast.
I know. So,
I put it on the front on the an introduction that we want to be that. We want someone to go and ask their doctor about something real.
100%, man.
Because one thing I've noticed in the way that you practice, because we do work together, is that you do check blood work, specifically even like a CBC. Obviously, I'm a little biased because I'm a hematologist. I think someone should have a CBC every year.
Yeah.
There's many times where I see a case where the primary doctor hasn't done just a basic blood test, and I feel like, why we have the tests. Many of them are cheap tests. They're not super expensive. We're not overloading the healthcare system. Like, why not do the tests? Like, and then people are afraid, like, hey, I'm going to find something. Like, I got my colonoscopy last year. There's always a little fear, like, hey, what are they going to find or whatever.
Yeah,
but
man.
like, I personally think everyone should have blood work every year for, and maybe you can say like what you recommend every year, like what kind of blood work, they should have.
Yeah, absolutely. I mean, usually around 30 is when I recommend it. I always give patients the option. We can check it at, you could be 21. We can check whatever you want, But the basic stuffs, like you said, like a blood count, a metabolic panel where we're checking, like, your liver health.
That's what I was going to say next. So what's in a metabolic panel? I think it's called a CMP. Is that right?
Yeah, CMP stands for Comprehensive Metabolic Panel. Basically, you're getting like your sugar at that time. It's going to give you some parameters on your liver health, kidney health, your electrolytes. I mean, you can gain a lot of info with just that test. And the blood counts, as you know, it's just a full panel of like all the different cell lines in our body. I like to check cholesterol. I like to check people's hemoglobin A1C, which is their 3-month average of what their blood sugars are doing. It's a lot better. It's a lot more indicative test of if someone is starting to develop insulin resistance. Are they starting to lean into diabetes? I usually like to start with that. And then, we'll add other stuff. Like if the patient is having issues with weight, maybe check their thyroid, maybe check some vitamin levels, So just like that basic kind of like, just checking your engine oil, making sure everything's looking good.
And what about those companies? I keep seeing and reading about companies that want to do lab tests all the time, more than that.
Yeah.
And where you're, paying a lot of money out of pocket to get these lab tests that, all these different things.
Yeah.
They're claiming it's a more, comprehensive picture of your health.
Yeah.
I don't work for one of those companies. As I told you earlier, this podcast is sponsored by Nobody.
Yeah.
I'm just curious what you think about those additional tests. I'm sure you've seen it too. Patients probably come in and say, "Hey,
Yeah.
doc, this is what I want. I don't
Yeah.
care what you think.
Yeah.
This is what I want."
Yeah, man. That's kind of like where this whole movement with like the bad information is coming from, where it's like quote unquote bad, I guess, is like just.
Well, we just don't know.
It's a lot, and you see it. People see this stuff on on Instagram or TikTok, and my whole thing with it is like, yeah, they have these panels where they'll do like hundreds of tests. The problem is we haven't really studied these tests enough to know, well, what's the management for it, right? And I don't know. I mean, the way I was taught was like, you order a test because it's gonna be something that you have an actionable event on, right? Like you don't order something if you're not gonna act on it.
Yeah, if you're not gonna do something about it.
Yeah, exactly. And so sometimes some of these panels, you're looking at this stuff. I'm like, well, we don't have any recommendations. We don't have any standard of care. We don't even have any good studies or data on what to do with this lab test.
Yeah.
All you know is what it is, and then, well, what are you gonna do with it now? You're just gonna sit on it, or maybe it doesn't even mean anything. Maybe it doesn't even lead to anything.
We just don't know. Basically.
You just don't know at this point.
So why get the test? So I think like that's like just causing worry and anxiety
For sure.
for something that we don't even know about. We're not saying that, hey, you read something on Instagram or whatever and you want to get the test, do whatever you want. But like we're just saying like it's just going to cause you anxiety without real knowledge, because I feel like this whole podcast is about facts, and the tests that we order have been proven. The stuff that we give has been proven in thousands of people to, if there is a problem, we can investigate it and figure out what the problem is before you feel bad. Because I think the greatest myth is, as we were talking about earlier, if you feel good, you must be good. And though, as you know, I take a cholesterol pill. My cholesterol's high. I feel fine, but it's in our genetics. That. So, and what about diet? You mentioned the obesity epidemic. Like, are you vegan, or are you like, you have all these chronic diseases?
Yeah.
Like, is there a specific diet that you're recommending for all your patients, or calorie restriction, or do you think everyone should eat potatoes at every meal? I don't know. Whatever you think.
Yeah, that's a good question. That's an extensive question, man. I think the biggest thing I think that's gone wrong in our diets is honestly just how capitalism has taken over it. It's so processed now. And, obviously fast food is just terrible. And I think it's like even getting worse as time goes on, because we gotta understand everything that's in our grocery stores and on our shelves and what we can just get at the corner at McDonald's. It's designed to be profitable, not to be healthy. And what is designed to be healthy is just clean and pure ingredients. And so the blanket statement I give to patients is, cook more at home, cook more from scratch. Just buy whole foods in their state, how they occur in nature, bring it home, prepare it at home so you know what's going in it. And I think that's like the basis of eating healthy and eating clean. And then into that, we get into the details. Like if someone really wants to lose weight, there's like a certain way you want to eat with like higher protein and limiting carbs. I think all the fad diets, if you start looking at them, they all have common denominators, and most of them are just like, eat a lot of protein and avoid a lot of carbs, and that's like the basics of that part of it, But I think the core issue with our diets right now is just I don't consider so much of this stuff that's in like our grocery stores. I don't even consider food.
So instead of doing a breakfast sandwich, maybe just cook some eggs and put it on some bread at home.
Man, get
that
some,
kind of thing.
Yeah, get some real cheese, not that like stuff that's like processed cheese product. Right? Make your eggs at home. Try to find a nice like a place where they're baking fresh bread every day. That kind of bread. Like that's how we get our bread from a bakery like that. If you leave it out, it's spoiled in like 2 days.
Yeah.
You buy this stuff at the grocery store, it's like, man, it's good for 3 weeks, So, and it's like, it's that simple. You just kind of have to shift.
Yeah, I think there's a cost component to that too. Obviously, fast food's much cheaper, but I completely understand what you're saying.
And I think that's where like patients will tend to tell me like, but it's expensive to eat healthy. And I'm like, no, it's not. Again, that's what the world has kind of shifted our mindset towards.
Yeah.
What it actually is, it's cheap to eat unhealthy. You know what I'm saying?
That's a good way to look at it.
Real food has a cost to it. I mean, when you go to Europe and you order something and the portion size comes out, you're just like, that's it, But it's like, it's because it's real ingredients that, if you were to get like a Cheesecake Factory, portion
so
size, it's
good.
going to be triple the price because they're using, they're using better products, man.
Yeah. Yeah. No, I think that's a good point. For the patients that you've seen, now you've been doing this, so many years, and I'm sure you have a lot of patients in their 80s and 90s,
Yeah.
for longevity.
Yeah.
There's this big push for longevity and, what are things people can do?
Yeah.
What are you seeing any common traits in people that are older? Is there, are they thin, non-smokers? Like,
Yeah.
is there some stuff that you're seeing that way?
Yeah, it's like these common denominators you see, and it's not as complicated, I think, as people make it. Yeah, I mean, I'll have patients in their 80s who are just, unfortunate. They're just sick, constantly in, multiple different doctors' offices,
hospitals.
multiple medical
Yeah.
problems, and then you have the healthy ones. And honestly, the healthy ones, it's basically what I'm telling them. They've always made a habit to stay active. They've always made a habit to eat clean, and they talk about like they have such a better answer to when I ask them about how they eat. They have such a better complete answer to that. You know what I'm saying? Like, oh no, we eat this, this, and this. We eat this many vegetables and fruits. We make sure we make this much at home. We try to avoid eating out, and when we do, it's limited. Like, they can tell me that versus someone who's like, well, yeah, I think I eat clean and all that, but I'm looking at their numbers and their weight, and I'm like, it's probably not, it's probably not applicable. And so it's that simple. I think just being mindful of your diet, not overeating, watching your weight, making sure that's always in a good spot. Because that's the other big thing.
It's an objective thing, right?
Those healthy people are always at a good weight,
Yeah.
For sure.
No, that's good. And I'm assuming they're non-smokers. And
yeah, for the most part, man. I mean, that's the other big one. It's just don't smoke, man. Cigarettes, I mean, the way it degrades, everyone thinks about the lung cancer aspect of it. But gosh, man, all the other
chronic
ways.
disease, right? People don't think about
absolutely.
that. Yeah. What about alcohol? Now, I know you and I are going to drink on Sunday. So I'm just wondering what you think about alcohol and damages to your health. I mean, we're all biased in that we're always, the things that we do, especially if it's a habit, we're like, oh, it's not that bad or whatever. But I'm curious because I think the conversation used to be drink a couple glasses of wine. We had another doctor on, a cardiologist earlier, and he said, yeah, there's some data that the wine helps with your cholesterol a little bit, but now that's been debunked, and obviously there's a cancer risk now.
Yeah,
it's a carcinogen. Yeah. So curious on your thoughts.
Yeah, I mean, the
I've heard everything is good except tequila. Tequila's good for you, but everything else is bad.
Yeah,
for you.
Supposedly tequila has the lowest inflammatory reaction. But. Man, alcohol, I would say everything in moderation, but yeah, like we used to say, like 1 to 2 drinks, you're fine per day. And I wouldn't recommend that. I think, it has its inflammatory effects. We know of its cancer risk, especially with like colon and gastric cancer and things like that. Heavy alcohol use is definitely going to speed up heart disease and make, and create that whole issue.
So you mentioned inflammation, right?
Yeah.
So I feel like a lot, do you get inflammatory markers sometimes? Like, I feel like inflammation is this buzzword.
Yeah.
And we're all trying to decrease it in a sense.
Yeah.
And like, for me, the way I think about decreasing it, and I want you to correct me if I'm wrong, because you're kind of the gatekeeper of all this. First of all, not getting enough sleep, uninterrupted sleep, 7-8 hours. That's the first thing. Then the exercise aspect, as you may have talked about, that can decrease your inflammation. Then, stress, even decreasing that. Your diet, decreasing that.
Yep.
So I think all of those things together, and not smoking, not drinking too much, all of those things together can lead to decreased inflammation in the body. I wanted to see what your thoughts are on that. And then the second is there any markers you could do to test for inflammation, or is that not being done right now?
No, there is. So that's one of those things. That's one of those tests where I can kind of get on board with a bit more, where they do check like some chronic markers of inflammation, like an ESR, a SAD rate, or CRP, C-reactive protein. These are like some labs that can indicate if you have a level of inflammation. I think where it's still kind of early is in its infant stages is like, well, okay, how are we going to track this? And I think the general recommendations you tell someone is, well, just live a healthier lifestyle. And I think how I'd imagine it being is like, well, we start tracking it regularly and seeing if it actually does come down. I would imagine that it should, because as you know, man, as an oncologist, like inflammation is the beginning.
Absolutely. There's a lot of risk factors, and thankfully, because of what you do, we're getting at patients early. I have more survivors than I ever thought I'd have because people are going for their screening tests.
Yeah,
and maybe
huge.
we can talk about that a little bit. 1 out of 2 to 1 out of 3 people will get cancer. That's just part of being alive. It's the number 2 cause of death in the United States, behind heart disease. And so sometimes I feel like, people don't realize that you can be completely healthy and something like that can affect you. Now, when we say the word cancer, I kind of want to be more specific as an oncologist that there are over 200 different types of cancer. There are common ones. Like obviously the most common in women is breast, the most common in men is prostate, and there's a lot of less common ones. And I think by doing this blood work and getting some screening, one thing, that I've seen a rise of in my practice is colon cancer. So like I went and got my colonoscopy, and I think maybe you can talk about the difference, the age, it's changed, right? I believe.
Yeah, so it has. It's changed from 50 to 45 for colon cancer screening, and it's just kind of like they look back at the data and they just saw like this massive, discrepancy. People over the age of 50, the number of colon cancer deaths had gone down significantly, and the people under the age of 50 it had gone up or it had maintained that higher level. And so with any screening test, it's like, again, patients will sometimes be like, if it ain't broke, don't fix it. And I don't like the idea of getting a colonoscopy. I feel fine. And I just tell people, I'm like, look, right now it could be tiny. It could just be a polyp, and, a couple centimeters, millimeters, whatnot.
And that's just like a growth on the colon, right? It's like
correct,
a benign growth on the colon.
Yeah, sorry.
Right?
Like a polyp is just exactly like a growth that you can, develop and,
and it can turn into cancer.
It has
down
the potential.
Yeah.
Not all of them will, but, it has the potential of turning into cancer. And
we'll have a poop doctor on to go over that more. Luckily, we don't have to do that.
You get in the nitty-gritty
of it.
Yeah.
But basically, you're trying to catch cancer or something before it even becomes...
Everything,
we're already catching stuff before it even becomes cancer.
100%, yeah.
So that's, I think when you send someone for that, basically, if they even find a few polyps, many times you've saved their life in a sense that these things could become cancer, right?
Yeah, man. Anything, it's like... What I tell people is like, I'll see you maybe once a year if you feel great. Mm-hmm. But if there's ever anything that you're feeling that's just kind of out of the ordinary, you don't have to brush it off. Bring it up to me, And it could be like, someone might come in and be like, I'm just kind of feeling a little more tired and I can't keep up with my workouts as much, And then we go into it and it's like, hey, you have impending heart disease now, Yeah. And we caught it before that guy would just drop dead of a heart attack. Yeah, absolutely.
We talked about this, in a prior podcast, but, the average life expectancy before we were born, 1975, I use 50 years as a marker because that's my next big milestone, but, was around 72, 73 years old.
Yeah.
And now it's closer to 80. And I think you're seeing a lot of older patients who are surviving probably more than you did before because of what you're doing in terms of, monitoring them, catching their cancer early, getting them on medicines to prevent, their heart disease, all that kind of thing. Is that
100%, man? Yeah. The screening part of it, I think medicine is getting better. I think our treatment modalities are getting better, right? And I just tell people, it's like, look, I think in every other facet of life, our environment, our air quality, water, our food, our lifestyles, all this, we keep getting worse. We should be dying earlier. But yet we continue to live longer. And that's my argument for medicine. I'm like, you can't rebuttal that. That's medicine, That's what's keeping us here,
we study for years. Yeah. We go through our residency. We went through all this. This is one of the points of doing the podcast. I'm not angry at anybody. But,
no.
Like people will come and they'll be like, well, I read this on the internet. And I'll be like, I want to be that internet.
Yeah, right. For sure,
I want to be like, you read this, you heard this on this podcast.
Yeah.
Because, people, we all have... I still think I got a chance to be in the next, U.S. Open if I get my handicap down. We all have these dreams and it's great, but then there's reality of the situation that we're in that
100%.
Unfortunately we're not going to live forever. So while we're here, let's enjoy it. Let's try to keep that car running, as smooth as we can.
No doubt, absolutely.
So we talked about the prostate cancer screening, breast cancer screening. Women, is it 35 or 40? I know there's this United States Preventative Task Force screening, but I'm not I see people after they get cancer, So.
Yeah, it's and you mentioned this before in terms of like doing these tests and what's kind of the harm in it, and some of these things, like even prostate cancer, is kind of like, it's just a blood test, right? And for breast cancer, it starts off with that mammogram. And, sometimes the bodies, the governing bodies are kind of like, contradicting each other on like when they should start and stop.
Which I think is okay, right? That's the whole point of science,
for sure.
right?
Absolutely.
Like, let's look at all the evidence and come up with the best possible solution. Nothing's perfect.
Yeah, no,
Like,
for
I
sure.
think if you have a completely healthy guy that's 80 years old and he's like, check my PSA, I know.
Absolutely.
Just check it,
like,
right?
Let's check it. What's the harm?
What's the harm, right?
Yeah.
So,
I think it's just important counseling the patients on what will come next if it's abnormal, and are they willing to do that?
And you're specifically talking about a biopsy, right?
Yeah, like biopsy, or before it was just like bad PSA, do the biopsy, invasive, painful test. Now we don't do that anymore. Now we kind of watch that PSA, watch it trend. We have MRIs that are really, a lot more sensitive these days, And
in 1975, just to be clear, 50 years ago, there was no such thing as an MRI. I mean,
Right.
like, they were just getting the technology then.
Exactly.
But now an MRI has no radiation. Is that
Zero
correct?
radiation, correct,
So there's
yeah.
really no, because it's magnets.
Yeah.
So there's really no risk
no
long
downside.
term to any MRI. Is that correct? Or?
Yeah. You can get an MRI every 6
I'll
months
get a
if you
radiologist
wanted,
on here. We'll talk. Yeah.
No,
so should
but-
you and I go for MRIs every 6 months?
Yeah,
then?
let's do it, man.
Get some drinks first.
Let's get some
and then
renewable.
sitting in that machine where it's coming down. It's pretty loud,
The downsides to doing that too often is you're probably going to start finding a bunch of incidental stuff that probably is nothing, and that might lead to a lot more testing that you don't need. I think and anyone who's questioning why we don't just pan scan everyone on a constant basis, I think that's the
I think it's a good point, but I also think it's coming.
Yeah, and I do. Yeah, exactly. So I do. And
I
as
think once
things
they
are
bring the
getting
cost
better,
down, I think it might come.
and plus you can zero in on things with better, testing modalities and labs. Like for example, breast cancer you mentioned. I recommend everyone to start getting mammograms at 40 years old every year. And now it's like, even if we see a questionable mammogram, the next step is either an ultrasound, which again has zero harm on the body, no radiation, there's nothing that's going to hurt the body to do an ultrasound, or you can do a breast MRI. And I mean, the amount of cancer then we can pick up by doing those next tests is pretty wild that we're not showing up on that mammogram.
That's exactly right. An MRI is actually a better screening test than a mammogram. And I think you bring up a really good point in that even though we're going to do these, because to me, everything in life is a risk and a benefit, right? So,
for sure.
I mean, anything I do, if I go running, I could tear my ACL. There's just a risk to everything. And so, to me, the risk to doing what you just talked about is almost nothing.
Exactly.
And the benefit is just so great. You can just make sure that everything's, okay.
Yeah.
Because because we know the human body is going to malfunction, whether it's heart disease or cancer or whatever, the sooner we get at it, there's clear data. Even my advanced cancer patients, as you know, we have very good therapies to put them in remission. The less of cancer there is, the better chances those therapies have to work. You know?
Catching early, right?
Yeah. So what are I just want to hear, because you see the general population, what are the craziest things? And we're not here to denigrate anybody. We just want to be positive and provide positive information. What are the things that people are telling you that you're just like, hey, we all have these patients that believe. Every year I have a patient that just goes to Mexico or does something. I'm not mad at that person. Everyone's got to do what they want. It's their choice, their body. I think the way you do that, our body, we're just lucky to be human, lucky to have a body, and we want to keep that Ferrari. All of us have Ferraris, even you, Mark. We want to keep that Ferrari going for as long as possible. As you said, I think your analogy is fantastic. So what are the things that you're seeing that may damage that Ferrari that people are reading about on the internet that maybe you would recommend them not doing?
I think
that's a tough question because it's everywhere, right?
Yeah,
so
I think one big thing right now is just misinformation. What comes to mind immediately is like statins, for example. Statins,
I take a statin, as you know.
Statins have been around for a long time. I mean, study on study proves that they're effective.
Well, thanks. I feel better.
Yeah, man. I mean, it's in the data, and any cardiologist you ask, right? And it's like,
and we did ask a cardiologist before this too.
Yeah. So I'm sure he agrees, but it's like there's like these supposed adverse effects that can occur, and I mean, and then again, there's studies that have been done to test these theories, like, it can cause dementia. Well, they did studies on it. They showed that there was no statistical there's no significance in increasing risk for dementia when taking statins. And there's all these other, people will be like, I've heard they're bad for you. I stopped taking mine. And I'm like, and they'll come to see me like, well, when did you start? 6 months ago. It's like, look, you're doing damage to your body. And the way I kind of explain it to my patients is I'm recommending this medicine for you. And you're concerned with the side effects and the bad effects of the medicine because of what that may do on your body, because of what you heard from whoever. But in doing that, we know statistically with data and science and studies that you are doing damage to your body by not taking that medicine. It's like you're contradicting yourself,
That, and also I think one thing that I try to bring up, and I know you do this as well, is that if you had a side effect to most medicines that a doctor recommends, and obviously you should see your own doctor as we have in disclosure, you can just stop it. And literally most of the time that side effect will disappear. It won't be permanent.
Yeah.
We won't get into the entire COVID thing, but if you get COVID even once, long COVID is like 5-10% of people have some long-term thing.
Yeah.
With medicine, with the statin, 99% of the time, whatever side effect you're having will reverse.
Yeah, and I mean, and people are not thinking about is as well, okay, if you're not taking the statin, your arteries are all getting clogged up, and that's, yes, it's going to put you at risk for heart disease. Yes, you may have a heart attack. Yes, you may have a stroke. But what about like things like vascular dementia, where it's like over years and years of having high cholesterol, which compromised your blood flow to your brain, you're now developing dementia because of vascular issues, because your blood vessels are essentially narrowed, So there's all these other kind of things that people don't think about when it comes to vascular disease that are also going to be preventable, And so it's like, I think a big part of it is just people's misinformation and then not wanting to follow through with.
And it sucks. I don't want to take my statin.
It just makes it a little harder for us to do our job, which is
take
fine.
Medications,
yeah, no, exactly. No one likes it.
No one likes it.
No one likes it, And it's like, well, am I going to be on this forever? And in most cases, I tell them, well, that's on you.
Yeah.
If you can come back and lose 50 pounds and improve your blood sugars and your cholesterol comes down, your blood pressure comes down, sure. Let's take a bunch of these medicines away.
Sometimes it's genetic. I mean,
so genetics is the other part of it, right? Yeah. That's our blessing and our curse, Yeah.
So, this question, I don't know if you'll be able to answer because, it's just, why are the Chicago Bears so bad? I mean,
hey, man. Well, I wanted to add, I'm not a Sox fan.
By the way, I don't know if you saw my shirt. This is back-to-back Kings of the North, I'm just saying.
So,
at least the Packers are gone.
Yeah,
we can just forget about them. I actually cheer for the Bears. If the Lions are not in the playoffs, I'd cheer for the Bears. Mainly because I want to see my friends happy and,
I was cheering for the Lions, man. That was a tough playoff loss, man.
Yeah, I was there. It was fantastic,
I think we've stacked ourselves. I think we're looking good. And I wanted to mention I'm a Cubs fan, not a Sox fan.
Sorry.
Cubs are
Cubs could meet the Tigers in the World Series, bro.
Yeah, it might be.
They might be. They're two best teams. It'd be fantastic.
Pretty wild, man.
Yeah, it'd be amazing. It'd be amazing. But it looks like their offense. We'll see if Caleb Williams is a real deal.
Yeah, I think they're up like 6.5 games. So
really?
They got a little cushion right now.
Oh yeah. Well, we'll see what happens. Well, hey, I just want to thank you for everything that you do in terms of taking care of patients. I mean, obviously, it's a little bit of a grind on us, every day to, take care of patients. I love it. I know you love it. I created this podcast because I'm not going to become a talk show host or, it's like, this is just hopefully providing some information for people. Just really appreciate what you do and thanks for coming today, man.
Same, bro. I love that you're starting this. I think it's good. I think this biggest thing is for people is just go see your doctor. Have faith. Have faith that they're trying to help you.
Find someone that you like. If have faith.
Yeah, man.
That's the other thing.
That's
the other thing the internet creates is just suspicion for everything. And you and I have been there.
Yeah.
Suspicion and fear.
Yeah.
I find that most people are just good people.
Yeah.
99%.
For sure.
There's always going to be a bad person. And I always feel like all of us remember the bad. It's just a natural human nature. You're going to remember the bad experience. Besides, not your 99 good ones,
100%.
Even when I have like once a year, someone may write something negative about me online or whatever. Like I'll remember that one and I'll forget the 99 other nice people that, put something. So anyway, man, thank you again.
This was fun, dude.
Yeah. Great. You got to come back.
All right,
and I do have a
man.
gift for you. So.
No. All right.